I was talking to an occupational therapist today, and we were kind of talking about our assessment tools and things that we're including in our evaluations when we're seeing a new patient in our clinic. And one thing that came up was airway and the mouth and the tongue and sleep health and swallowing. And all of a sudden we had to circle back and we were talking about why this connection exists and why it matters. And that's what I want to talk to you about today, about why this connection exists, what you can do about it, how to look for it in your child, and then ways that we can help from a pelvic health therapy perspective. So at Unconstipated Kids, we screen for and assess and help to treat a lot related to the tongue and the mouth. And the first thing that you need to do is understand why. And I like to take a step back and use the birth world as a great example. So in the birth world, midwives or OB-GYNs and nurses, labor and delivery staff are often recommending that a relaxed jaw, low sounds, open mouth, this any kind of variation of that can be really helpful to helping a baby to descend with more efficiency. And so when we think about this concept of relaxation in the jaw leads to relaxation through the pelvic floor, that connection, whether that's just observed clinically or backed by literature, that exists. Literature is trying to catch up, but there is this anecdotal perspective that that connection exists. There is some literature, another conversation. But if we acknowledge that in the birthing world, that relaxation in the jaw leads to relaxation in the pelvis, and the reverse is also true. If there is tension here, then maybe there is tension in the pelvic floor that it's restricting the birth process a little bit. If we acknowledge that those connections are there, then might it be true in relationship to bowel movements and bowel and bladder health, that if there is tension or restriction or shortened connective tissue through the jaw and the mouth, might that contribute to restriction and tension in the pelvic floor? The short answer is yes. At Unconstipated Kids, we believe that. So this means that when we're working with kids with pelvic floor dysfunction that's contributing to their bowel and bladder symptoms, that we are then also making sure that their tongue, their jaw, their mouth, their teeth, their airway, their feeding habits, all of those things seem appropriate. And we're screening for it. We're looking for maybe some yellow flags that maybe they need some help in this part of their body, because if there's habitual tension through this part of their body, then that's going to translate into the pelvic floor. So one of the best things that you can do is just to simply observe your child. So as they're doing movements like running, skipping, going upstairs, standing up from the floor, focusing on a task, doing their homework, watch what their mouth is doing. If their tongue is kind of doing some interesting movements, if they're jutting their jaw forward, if it's going side to side, if they're suctioning through their cheeks or pushing out and bulging through their cheeks, doing a lot of lip movement, those could be signs that there is either overflow or lack of isolation and coordination through their body, and they're using other muscle groups as a recruitment compensation mechanism to try to complete a task. And basically what that means is, let's say they're trying to stand up from the floor. If they're weak somewhere else in their body and they can't stand up, they're going to recruit other muscles, or maybe there's a lack of isolation. And so all these other muscle groups are kind of joining in like, we can help, we can help. And those muscle groups are trying to help your child stand up from the floor. But do we use our lips, the muscles in our lips, to stand up from the floor? No. But if they're joining in to try to help complete this task all day, every day, then that's going to contribute to tension that really shouldn't be there. We shouldn't be using our lips all the time to stand up from the floor. So that's kind of a one basic way that you can look in your child to see if there are challenges related to their airway and jaw. Another thing that you can look for is Their feeding habits. Are they pocketing food? Are they clicking or making some interesting noises when they're eating? Are they having some articulation issues and maybe they're already in speech therapy? Are they gagging on foods that you think they really shouldn't be gagging on? Are they having some food aversions? It could be preferences, but maybe it's this food is too difficult for me to chew and manipulate in my mouth and to then swallow because maybe the movement pattern to swallow and chew that food is too difficult. So those are possible clues that your child has some challenges related to their mouth and airway. Now, the best thing that you can do to help them is to start helping bring awareness to it. That's the first thing that you can do. From a person who's just sitting at your house, you're realizing that your child has some of these things and you want to help them. The first thing that you can do is, as they're doing a movement, help them notice, hey, you just did this movement. Did you notice what was happening in your tongue? And if they say no, have them repeat the movement and pay attention to it. If they still don't get it, you could try a mirror, do it in front of a mirror. Or you can just tell them, hey, when you're standing up from the floor, I see your tongue kind of jut out to the side. Do you think you could try to stand up from the floor again and keep your tongue up into the roof of your mouth? Now, just a little aside, we're going to talk about best oral posture for a second. Best oral posture is when our tongue is slightly suctioned to the roof of the mouth, our lips are relaxed and closed, and our teeth are slightly open. So that's an ideal resting posture for our mouth. So if you can help your child to do different movements while they're keeping their mouth in that great resting oral posture, you're helping them to work on isolated movement tasks. That means that instead of standing up from the floor and recruiting their mouth muscles, they're now standing up from the floor and only recruiting the muscles of hip and leg strength to get them to do that. How does that play into pelvic floor health? That means that when your child is wanting to or needing to think about their body, their bladder, their bowel, do I need to go? It's easier for them to perceive that information because they are already better at isolating their sensory perception. Their experience in their body, they can isolate that instead of their whole body kind of kicking on to help them complete a task. Their body is also more used to isolating the movement pattern or the motor plan of something. So that means that when they sit down on the toilet to push poop out, they're not recruiting all of the other muscles of their body, right? Trying to get their poop out and straining. Instead, they can isolate it and only use the muscles that they need to be able to have a bowel movement instead of their whole body kicking on, which leads to tension and overflow and really just a harder time going to the bathroom. If you are unsure if your child needs some help related to their mouth, if you're unsure if they need pelvic floor therapy or if they need myofunctional therapy, we would love to help you. We offer free calls. And so that can be a great place to start. We can talk about what your child is doing on a regular basis, what their bowel and bladder symptoms are like, and then if we think that we are a great place to start, or if maybe someone else and a different provider or a different approach might be a better place to start.
Hi, my name is Dr. Caitlin Keller, and I am the owner and lead physical therapist at Unconstipated Kids. And here at Unconstipated Kids, our mission is to help kids move through and graduate from the challenges related to toileting struggles. So things like constipation, nighttime bedwetting, belly pain, reflux for infants, any kind of challenges related to the gut and toileting, keeping their underwear clean and dry. I hope that today's video pushes you into the right direction to get a great jump start and to move towards full resolution for your child from the challenges they're experiencing.